So we'll start with this 15th knowledge sharing session with parents after an invocation prayer. So let's have an invocation prayer.
सद्गुरु को पहला करो प्रणाम, सद्गुरु को श्री गुरु को पहला करो प्रणाम, सद्गुरु को। से मिलता है गुरु, बंध विमोचन करता है गुरु। परम भाग्य से मिलता है गुरु, बंध विमोचन करता है। जानने वाले जानते हैं श्री गुरु महिमा की अधिकारी। जानने वाले जानते हैं श्री गुरु महिमा की अधिकारी। करो प्रणाम, करो प्रणाम, करो प्रणाम, करो प्रणाम, पहला करो प्रणाम, सद्गुरु को पहला करो प्रणाम, सद्गुरु को श्री गुरु को पहला करो प्रणाम, सद्गुरु को। जीना सिखा दिया, इंसान बना दिया, काबिल बना दिया, अपना बना दिया। जीना सिखा दिया, इंसान बना दिया, काबिल बना दिया, अपना बना दिया। जो दिखलाता, ज्ञानहीन को जो समझाता, ज्ञानहीन को जो दिखलाता, ज्ञानहीन को जो समझाता। सबको समान प्रेम बांट के धर्म का पालन करता है। सबको समान प्रेम बांट के धर्म का पालन करता है। करो प्रणाम, करो प्रणाम, करो प्रणाम, करो प्रणाम, पहला करो प्रणाम, सद्गुरु को पहला करो प्रणाम, सद्गुरु को श्री गुरु को पहला करो प्रणाम, सद्गुरु को। श्री गुरुदेव, जय गुरुदेव, सद्गुरुदेव। ओम गुरुदेव श्री गुरुदेव, जय गुरुदेव, सद्गुरुदेव। ओम गुरुदेव श्री गुरुदेव, जय गुरुदेव, सद्गुरुदेव। माता पिता से जीवन पाया, दुनिया से व्यवहार अपनाया। माता पिता से जीवन पाया, दुनिया से व्यवहार अपनाया। लेकिन आत्मज्ञान कमाल गुरु बिना कौन दिखाएगा। लेकिन आत्मज्ञान कमाल गुरु बिना कौन दिखाएगा। करो प्रणाम, करो प्रणाम, करो प्रणाम, करो प्रणाम, पहला करो प्रणाम, सद्गुरु सद्गुरु को पहला करो प्रणाम, सद्गुरु को, सद्गुरु को, सद्गुरु को।
Sadgurunath Maharaj ki Jai. So as I mentioned, we are here for the 15th session, and I'm very, very happy to welcome all of you for this wonderful, informative session. And first of all, I would like to brief you what's happening in the school. Our 10th and 12th graders are writing their board exams, so I require all of you to wish them and bless them so that they do their exam very well. At the same time, our junior school children are preparing for their annual exam, which is going to start within 10 days. Our 9th graders went to Aircard and they have returned back today. Very, very happy and excited they were throughout the tour. So they are back to the school. Just now they entered. And now I request our Dr. Rajendra, he's a professor and head of Preventive Cardiology, PhD Institute of Medical Science and Research, to brief us on 6 pillars of lifestyle medicine. Over to you, sir. Thank you for gracing us with your presence.
Good evening, everyone. Am I audible now?
Yes.
I hope so. Right. Thank you. And thank you very much for the administration for taking up this topic, which is often neglected. And good evening to all the parents. You can always stop me if I'm found to be boring. So when my friend Mr. Ganesh asked me whether he should introduce me, I said no, because I thought I will introduce me the way I want. And this is my hobby. I get into the nature, and this is from my terrace garden. So these are my 2 pets, and this is my lunch, and that's my breakfast. I've got into this habit of running a few years ago. This is my present status. And when I joined as a cardiologist in this hospital, I kept doing a lot of interventions. Interventions means opening up the blood vessels and closing up the unwanted blood vessels. This is what I was doing. And suddenly I realized that I was actually catering only to the tip of the iceberg. The iceberg being so big, so much things can be done. That's the reason why I switched over myself to preventive cardiology. So the 6 pillars are like this. Here: diet, exercise, sleep, stress, risky substances, and relations. If any of you has undergone a blood test, you would have heard this term ESR. So here there are 2 E, 2 S, and 2 R. Very easy to remember. We will keep repeating this often, so there's no need to worry about this. So the tip of the iceberg is the one which we all focus on. As cardiologists, as patients' relatives, we focus on how much is the block and how to deal with it. But lifestyle medicine deals with the entire stuff: how to prevent, how not to allow progression of the disease. So that's the essence. So as I said earlier, this is the tip of the iceberg, and it all happens because of blood pressure, sugar, obesity, and deposition of cholesterol in the blood vessels. Why does that happen? Because of our behavior. That behavior is what we call as lifestyle factors. And that there is another factor which can be detected before the disease actually manifests. Let's not touch upon that. So the heart is made up of, the whole body is made up of blood vessels right from head to toe. So you have blood vessels all over the body. And depending on where the blockage happens, the manifestation differs. It could happen in the eye causing blindness. It could happen in the brain causing stroke. Somebody is paralyzed, it's because of the blood vessels, brain blood vessels getting blocked. It could be in the heart. So you all are familiar with the term called heart attack. It can happen to the kidney. So kidney can injure. And if it happens in the legs, that's what leads to what is called as gangrene. So you would have seen people getting their legs removed. Okay, that's all because of the blockage in the blood vessels going to the blood vessels to the legs. So it's almost like this. It's just like a pipe. Okay, and what we throw inside is the one which causes the blockage. And how do we deal with that? So if there is a blockage in any of these blood vessels, we can remove a portion of it, clean it, put it back, or we can introduce a cleaner. We can remove the pieces of muck inside, or we can pour in something like this, some hot water or some solvent to get rid of this muck. Or this could be like you can introduce some wire or something like that to get rid of the muck. So does it simulate something to something? Does it ring a bell in you? So this is like doing an angioplasty. This is like taking some medicines. So this is again an angioplasty or a surgery. So why does it happen? That's the most important thing. This all because of what we throw inside this basin. So we would have left out like things like this. So that is food, that is diet. Second thing is, if you leave things for a very long time without doing anything, that's what most of us are doing these days in the name of modern technology, sitting in front of the systems, not exercising. So here it has, the pipes have not been used for long. The third one is stress. So stress. The fourth one is spoiling our sleep, or working all the time in front of the system or whatever it is to earn money. And then risky substances. This is because it's a hard water basically. And the environment, last one, relationships. So this is exactly like our 6 pillars of lifestyle medicine. So as I said, the blood vessels are also like tubes, and you can see in the next picture how the blood flows. So here the blood vessel has been opened up. Okay, fine. So what really happens here? So this is basically the blood vessel. The blood flows here. You can see the blood cells flowing inside there. For some reasons, the innermost part gets injured and all that cholesterol gets inside the blood vessel. This is the vessel and it slowly grows. Okay. So this is the process called atherosclerosis, or basically buildup of cholesterol inside the body, inside the blood vessels. At one point of time, another part breaks up and all this whatever is inside comes out and clogs the entire vessel. So how long does it take for this one to happen? If the heart attack is to happen, this is just a cut section of those blood vessels. You can see there's a clean blood vessel. Here a portion has been lifted. That's because a little bit of fat is inside the vessel wall. More here and more here. Okay, we'll see it in another way. So if you are to earlier days, I think maybe 30, 40 years back, when we say heart attack, it always meant people around 55, 60s. Okay, so if the heart attack is to happen by 50s, the blockage would have started by 30s. But nowadays we see people getting into heart attack in 30s and 40s. So in those patients, in those persons, the blockage starts much, much earlier. That's around 20 years. Okay, so obviously it gives a message that if you are a heart patient, your process would have started 2 decades earlier, and it's time you focus on your family, your kids. Don't say that this diet is only for me. No, women especially, they say this diet is for you, and rest of the people will continue to enjoy the same risk factor. Okay, that should not be happening. Okay, this is a small story of Mullah. Okay, Mullah, this person is the Mullah, and he gives a small pot to a boy, and he says, go and fetch me water. So he also gives him a warning saying that this is a mud pot. I don't want it to get injured, get damaged on the way. So if it gets damaged, I'll give you a slap. So this boy takes a few steps towards the pond, but what happens is the mullah calls him back and gives him a slap. Now the onlookers are surprised. They say, why did you slap him? He hasn't even fetched water, or he hasn't broken the pot yet. So why did you do it? So he said, there's no point in hitting him after he breaks the pot. Okay. So we all have a different notion about prevention. So why does the heart disease happen? Okay. the heart, no, in a routine health checkup, we all want to prevent heart problem. If somebody dies in the neighborhood, we all immediately say, okay, we will go and get ourselves checked up. So what we do is we go and get some blood tests, some ECG, echo, treadmill, all those things we get. And finally, we just say that this, we check the blood pressure, sugar, cholesterol, and the doctor asks whether you have some bad habits, checks your weight and body mass index, and then asks you whether you have a family history. Okay. But if you take 100 people who have had a heart attack, only 50 of them will have any of these risk factors. Okay, the rest 50% will not have any of the conventional factors. I hope it's clear now. Okay, so there is no point in just checking all these things and saying I'm perfectly normal. That's not the case. Okay. So this is where the lifestyle medicine comes into picture. I already told this ESR. I will keep repeating it again and again. So this is these are the 6 pillars, and when you include all these 6 pillars, this is what happens. Okay, so 1, 2, 3, 4, 5, 6, all 6 pillars are there, and all these 6 pillars, if corrected, 50% of a heart disease comes down. Is it really the fact? Is it 50% alone? No. Even the other 50, you can see that blood pressure, smoking, all those things will come down if you follow a good lifestyle. So it is almost, if you follow lifestyle, all the 6 pillars, so the the likelihood of you getting into a major issue is very, very less. So what is the first one? I said it's eating. Okay, it's all about food. Can somebody answer this question? Diet, is that a noun or a verb? One of you can try it out.
It's a verb.
It's a verb. So is there anybody who's saying it's a noun? Okay, the word diet is derived from dietan. Okay, so in Greek, it's a noun. It's basically a way of living. It's just not food. All other daily habits come under diet. Basically, all 6 pillars come under diet. Okay, so if you are in Latin, in Latin, it is a verb. Okay, to lead or govern one's own life. So, but I feel it's more than a verb or a noun. I think it's a complete sentence, and it so happens for some people it becomes a dead sentence. Okay, and that's the main reason why we are focusing on. So why diet is important? This is a study done in 2016 in India, and people, we all keep talking. I said that those amongst those 6 circles, 8 circles which I had put up, I said diabetes, blood pressure, sugar, all those things. But see, what is the first risk factor? Dietary risk factor. Okay, not very often people ask, when you go inside a hospital with chest pain, the doctor asks whether you are smoking, whether you are taking alcohol, anybody has had a heart problem, whether you are a diabetic, hypertensive, but not many people actually ask about the diet. They all treat you, and then in the name of counseling, there is a few minutes allotted for diet. Okay, but see what is important. Let's see the next one. Amongst the diet, what is the most important thing? Again, I think I will leave it to the audience to answer this. So what is the most important risk factor amongst the diet that produces a heart disease? Maybe a few answers. I'll wait for a few seconds. Because this is the most important pillar.
Water.
Pardon, sir?
Water.
Cholesterol. Okay. Amongst the food.
Sugar, sir. Sugar.
Sugar. Okay, fine.
Sugar and oil.
Oil, fine.
Coffee, tea.
Junk food.
Salt.
Well, none of you
Saturated
are wrong.
fats.
Well, saturated fat.
What to eat, when to eat, and how to eat.
Very good. Okay, fine. So the what to eat is the most important thing. All of you said, yeah, we'll close off this discussion. I'm partially not able to hear this thing. There is some problem here. Okay, fine. Doesn't matter. So what to eat is more important than what not to eat. Okay, let me remove this part. This is what you all said, isn't it? some of you said um, non-veg, somebody said cholesterol, some said oily food. All those things come under the bottom. Okay, and see what is more important. What we don't take is the most important thing. Okay, if you are not taking enough of fruits and vegetables, if you're not taking whole grains, that becomes the most important risk factor. Okay, so the most important thing is what we are not taking or what we should actually be taking. Okay, so this is something which is being not taught. Now, whenever we go for a counseling, people say, don't eat this, don't eat this, don't eat this. That's not very important. What is important is what you should be taking more. Okay, let me pass on one simple message here to all the kids, if they are listening here, if they are in this audience, and their parents. The fruits and vegetables must be forming half of your plate in all the 3 meals. So 50% of your food, which will account for at least 4 to 6 servings, 4 to 6 cups of fruits and vegetables per day. That per se will reduce the risk of heart problem by many fold. Okay, can you spot India and China here? Can you spot India and China here? So who is better placed here in terms of heart disease? India is in red color and China is in pink color. You see this? In India, amongst 1 lakh men, around 200 to 600 people are having heart disease. Whereas in China, if you take the same 1 lakh men, the incidence is less than 100. What is the cause? Can somebody say this?
They eat more liquid foods.
Okay, fine. I will not ask questions because I may not be able to hear. So
They can put it in the chat, sir. They can write
they can
it in
put
the
it in the chat.
Yeah, you can use the chat and please write your answers.
Yeah, I think I've already shown the answer here. That's because they eat a lot of vegetables, much more than what we do. Okay, and China consumes the most vegetables in the world, 50% of that, and fruits also. So if there is one single take-home message, I think this should be the one. Okay, okay. So when we are taking meat, we try to garnish the meat and try to make it better, possibly for a look. But this is the way meat has to be eaten. So meat should be used as a garnish if at all it is taken. I'm not saying take meat. Okay, I'm totally against that. We propose whole food plant-based diet. There is no nil animal food, and everything is processed. It's a whole food. So that's what we advocate. Okay, but it's very difficult to change everybody. So if you are to use meat, this is the way it should be taken. And what are these 5 places? Any idea?
They are the blue zones, sir.
Excellent. Okay, they are the blue zones. So blue zones are the places where people live more than 100 years. More than 100 years. Okay. So I'm not going into the depth of this, but I will summarize few things for you here. So this is harahachibu. That basically means that you take only 80% of your stomach. That's the main thing. And look at this. It's not that blue zones people do not take non-veg, but their proportion is 95:5. 95% plant-based and 5% animal-based. I'm not going into the specifics of what they take in the animal-based. So they also take more of carbohydrates. Look at that. What carbohydrates they take. Okay, they take more greens, vegetables. They take a lot of sweet potatoes. Okay, and the fat is more in the form of nuts rather than the meat and oil. And the proteins are more in the form of beans, tofu, and greens. Tofu is basically soya paneer, than dairy. That is something which is important. So I think if at all you are consuming non-veg, it should be less than 5% of what you eat. I think this will give an idea. Okay, we all keep on saying you reduce calories. Okay, it's not a question of reducing the calories. It's a question of eating good things more. So whenever we go to a doctor, we want to reduce the weight. People say cut down, reduce the amount. Okay, our mantra is basically eat more of good things. You would have seen my food plates. I showed you my lunch, and I'm sure I must be eating much more than many of you. Okay, so and look at this. So if you are to take only 500 calories, okay, if you take fruits and vegetables, that almost fills your tummy. If you're going to take meat, it just fills up half of your tummy. And if you're going to take oil, it's very little of your tummy. So if you take very little oil, that itself becomes 500 calories. And if a doctor says that you have to take 1500 only, see how much you have consumed already by taking oil. Okay, I will play this video. This is following the World War, where actually the Germans took away from Norway all the animals. Okay, so there was nothing much left for the Norwegians to eat in the form of non-vegetarian. Okay, so they had to basically go to the public distribution system, and this is the public distribution system. So minimal food was available. Of course, the quantity was reduced here, but what is more important is they had to rely on homegrown, locally grown or seasonal foods and vegetables, and very little of food, and without non-veg. So let's see what really happened following this. The heart disease was growing like this from 1927 to the onset of Second World War. And once the Second World War, the Germans invaded Norway. That's the place. So see the way how it dropped. The heart disease, the death due to heart disease came down drastically, only to go up once the war stopped. Okay, so this is the summary of the dietary pillar. Breakfast like a king. Eat at home, cook at home. Rather, I didn't say eat at home because we keep ordering nowadays. So cook at home. 80% stop at 80%. I mean, when your stomach is full, you can go for intermittent fasting or even fasting, one full day fasting once in a while. And second is exercise. I'm sure all of you know what exercise does to your body. So there's nothing much to stress, but again, I'll show some examples from the blue zones. So we are all unfortunately used to going to gym, especially around the New Year time to reduce our weight. But most important is to move naturally. This is what these people in Okinawa and other places, Loma Linda, all those things they were doing. And every day they used to hike. All these things are hilly regions or around the oceans. So they used to hike a lot. So every day they used to burn around 500 calories, which is almost equivalent to around 2 hours of bowling or 2 hours of brisk walking. Okay. So look at this. All these elderly people are also they used to climb up hills. And this is a person who is in his 99th year. See, water skiing. He is doing water skiing. So this lady is enjoying vitamin D from the sunlight. Look at this, people involved in gardening, involved in yoga, and look at this doctor who died at 104 and was operating at hundreds. So that's the main reason why these people kept living for more than 100 years. The third one is stress. Again, I'm taking up the same example of blue zones. There are plenty to show, but then I will limit myself to blue zones. Look at this, evening get-togethers, sharing of food. I think there's one slide showing sharing of food. Whatever is their illness, they still kept walking. They didn't limit themselves inside the house. They just not walking alone. It was walking together with their friends, sharing their thoughts, sharing their emotions. And look at this. Okinawa people went to worship their ancestors. This is Loma Linda. They went to church, shared their thoughts. From Icaria, that is Greece, people had a short nap in the daytime. And in Sardinia, they used to enjoy their beach. So, and this is Loma Linda. So all of you know about the Seventh Day Adventist. So Seventh Day is basically for us to enjoy. That's important. So they go all out. I mean, in the weekends towards Saturdays and Sundays, their preparation starts on Friday itself. What do they do on Friday? So they don't order food. They prepare food for the next 2 days and take it along with them. And they enjoy those 2 days. That's the most important thing. So and they all had a purpose of living. Why do we get up in the morning? Not just to go for work. It's something beyond the work. So if you have some purpose in your life, then you live extra 7 years. So knowing why we get up in the morning is one of the greatest antidotes for your downs in the life. So whatever adversity crops up, if you have a purpose, I think you will always overcome all these things. That's the most important thing. I'm sure some of you would have read this book, Ikigai, and the blue zones trifecta. This covers 3 pillars here. One is your food, because they have grow their own food, and they all climb up and grow this. So they take care of their physical activity, and this is also for stress management. Now the 4th pillar, nothing much about the sleep. All of us know that we need to sleep well, but we all compromise sitting with our mobiles. That is the thing which disturbs and causes stress the next day morning. So look at these people, they rise with the sun. Many of the times we don't see the sunrise at all. That's what promotes disease, and they sleep with the night. So one more thing I thought I should share. This is about Napoleon in the warfield. Napoleon used to take a 20 minutes break. What he does is, even when the war is very actively going on, he just calls his subordinates, hands over, and then he goes into artificial tent created there. He sleeps for 20 minutes and comes back and starts working on the field, just like what he did early in the morning. So this is called Yoga Nidra by Satyananda Saraswati, Bihar School of Thought. Then risky substances, all of us know this. Again, I don't need to elaborate. This is, I think, apart from smoking and alcohol, the risky substances would possibly include mobile usage. And this is one single point which I wanted to point out in this pillar. The Seventh-day Adventists, though being Christians, were not using alcohol. And the last pillar is about relationships. So I'll share one more story here. Okay, this is about a man who forgot to die. I'm not sure. Has anyone read about this? The man who forgot to die, or the people who forgot to die? Okay, so this is all about a person called Stamatis, and he was working in the warfield. He got injured in the warfield. So from Greece, he moved on to Florida in his 40s, and there he made up his family. He was living very happily. Once when he was climbing stairs, he found breathless, and then he went to a doctor who took a chest x-ray and said that you have a cancer of the lung. So then he was told that he had only 6 months to live. Maximum of 12 months and not more than that. So he doesn't know what to do. He initially says, okay, I will die here itself. Then he comes to know about the funeral cost, which is many-fold higher than what he would have had in his home place. So he decides to go home and settle with his family. So initial few days, his family took care of him. He was in bed. He thought he will die peacefully with the family. But then one day he decides, okay, I will go to the church. So he goes to the church. He meets up with his old friends. Then he starts meeting them every day. Then slowly he feels better. And what he does is get back to the original food. So this is the typical salad of their place. And he starts having his own garden. So he starts the vineyards. He takes up the wine which is produced from his own place, and all these vegetables. This is one form of a tea from their place. The other one is the wine here. So he starts taking all the locally made ones and the herbal teas. So he feels better, and he goes on to live for another 4 decades. So this is, I think there is a movie on people who forgot to die. It is a documentary in which he is being interviewed. So did you go back to the doctors and say that you are alive? So his reply was like this. So he says that none of the doctors who said that he won't live long are not alive. None of them are alive. So what is this one? Do you have 2-3 minutes extra?
Watermelon.
Yes, sir. Yes, sir.
Yeah. What is specific about this watermelon?
Shape.
It's square. Square.
Japan square.
Japan
Square in
square.
shape.
Yeah, it is square shaped. So how did it come up? Is that a real square watermelon at all?
They
And
mold
if
it.
so, how did it come up?
Mold by growing. Mold by growing. While growing.
Yeah, while it is being grown, that means when it was very small, they put a square box around it and it tries to accommodate that space and becomes a obviously you know why this particular slide has been put up. If you want to mold somebody and prevent from heart disease or for that sake any chronic illness, you should start in the young. So here I think parents are here, so parents should not be thinking, okay, this is all for me, this is for your kids too. So unless you follow it as a whole in the family, it is going to be extremely difficult to sustain it. Okay, if you're going to have two different sort of cooking at home, it is just definitely not going to be sustainable. So this is my passion. I started this Pearl Clinic. I run it in PSG Hospital. Pearl Clinic it's not a separate clinic. Every word of this has a expansion here. This is what really happens there. We try to detect a heart disease early before it manifests as chest pain and try to prevent that. How do we prevent? By concentrating on all the 6 pillars. So we have a big team here with us. So that's the integrated approach. Novel methods, I didn't touch upon that. That will be little too much for today. And continued care. Okay, because continued care is basically we call up people, see whether what is the difficulty in following what we have taught them. So if somebody is interested, they can take up this QR code. So any idea about Christian Bernard? Who is Christian Bernard? Christian Bernard is the person who did the first heart transplant. And this is what he said. Okay, if somebody is about to die, don't throw away their heart. Give it a person who will get benefited. Okay, so otherwise it will be definitely be taken up, consumed by only worms. The same person, after doing 150 transplants, he said this: I've saved lives of 150 people from heart transplantations. If I had focused on preventive medicine earlier, I would have saved 150 million. So that's the mantra of our clinic. And this is the wish for people who have attended today. So in Sardinia, Akia means live long, live to 100 years. So if you want to live 100 years, it's just not about taking medications. It's not about keeping your sugar, blood pressure, things under control. It's about changing yourself in terms of lifestyle. So this is my slogan when I end the talk everywhere. Inevam ideyam kaaka. Thank you very much for this opportunity and patient listening. I'm sorry I couldn't hear some of your comments, but I can take up. I will switch on my mobile and take up the queries.
Yeah, I request the parents, if you have any doubt, any query, you can post your questions. You can ask sir also, sir will answer. I would like to hear some. Yeah. Sir, close your screen, sir.
Just a minute.
Yes.
Thank you. Yeah. Anyone wishes to ask any question?
Sir, I have one question. Sir.
Yes, sir.
So how, before COVID, after COVID, sir, actually some of the diseases are attacked actually. We don't know that is impacted with either in form of COVID or mainly BP and sugar as attacked, sir. Earlier, due to either vaccination or COVID. Any resolutions for that?
Rajendran sir, you could hear him?
Doctor?
Can you, yeah, can you hear me?
Yes, we can hear you.
Yeah, just a minute, just a minute. Okay, I'm handling two of these things. One in the mobile in the hand, other one is this thing. I have to mute one of them. Okay, fine. So that's about the post-COVID scenario. Okay, so we don't have much data in India, but it's a truth that COVID has increased obesity and diabetes. Okay, that is all because of our own lifestyle. Okay, we started having all our meetings online, and obviously when we start doing online meetings, we know what happens by the side. Okay, we start eating a lot. Okay, that's not the only reason. COVID has some other reason also. Okay, so instantly when you say COVID has another name, obviously you know what it is, corona, and the heart vessels are also called as coronary vessels. Okay, the first 6 letters are the same for corona and coronary vessels. Now, why coronary vessels means the vessels running on the blood vessels where you get the blockage which leads on to the heart disease. Okay, so the corona and coronary vessels are named so because they look like a crown put up on your head. Okay, I showed one video. Just a minute, I'll share that screen here. I showed this video earlier. This layer is called endothelium. I don't get into those technical details. So this is called endothelium. The corona affects this endothelium and causes more breakage of this endothelium. Okay, it is just not corona, any infection. So when you have an influenza, when you have any fever, this endothelium is prone for any bacterial or viral infection can affect this endothelium. So that is the basis of coronary artery disease. So you would have heard that corona incidence was high in patients with heart disease, and deaths were high in people with heart disease. Not only that, the death in corona was also due to some blood vessel problem, maybe because of a blood clot inside the vessels in your leg or in the lungs or in the heart or in the brain. People were dying of stroke, people were dying of gangrene. So this is what was happening. So corona actually started affecting the blood vessels in the innermost layer. Okay, similarly, so you remember this 1920s, we had the Spanish flu. At that time also heart disease was more. Okay, but to give the last point, people who were following lifestyle were the ones who were the least affected. So all of them are actually interconnected. So instead of blaming everything on corona, I think if we had a good lifestyle, we would not have manifested so much. And even if you had a infection with corona, the death rates would have been less, and you would not have put up obesity if you had continued to do the lifestyle modification the way it should have been done. Is it clear?
Yes, doctor.
Thank you, sir. It's clear. But any prevention actions we need to do right now, sir? BP.
Prevention?
Eating more vegetables. That's what you're trying to say. How to prevent right now, sir?
Which one?
BP. Blood pressures.
BP. How to prevent BP?
Oh, BP. Fine. Okay. Blood pressure also, as I said in those one diagram with a lot of circles, I said it is also a lifestyle disease. Okay. So there are again all the 6 pillars apply in blood pressure also, but the most important thing here is all about the dietary aspect. Okay. One hypertension could be genetic. Okay, heart disease could be genetic, but what is important here is all the people who carry the genes will not end up in hypertension or heart disease or diabetes for that sake. Somebody's family people might be having diabetes, hypertension, heart disease. It doesn't mean that the person in question will also end up with a heart disease or hypertension. Okay, so it is basically now it's a question of pulling the trigger. The trigger is pulled because of our lifestyle. If you are going to adopt a bad lifestyle, then the genetic problem will manifest. How many of you have seen this movie called You Are What You Eat? In the documentary in You Are What You Eat. This is some request from my side. I think this is a documentary which should be screened in the
Netflix, sir.
your school. Okay, that is something which is important. This You Are What You Eat is basically based on a study published recently. It is on twins. Okay, the twins carry the identical genes, and both of them are prone for a problem. So these people have been followed up for ages. One group has been given only healthy food. The other group has been left to their choice, and they have followed and seen what are the results. So we can't say that the genetic, because of genetics I'm my gene I'm obese. Okay, so if you don't want, if you don't pull the trigger, it's not going to fire. It's just loaded with the material. So unless you trigger is basically eating wrong things, not eating good things, again not doing physical activity, carrying a lot of stress, and living without a purpose, or all that stuff. So prevention is again focusing on six. And you don't need to take individual, I mean, you don't need to, you don't have a specific this thing for each. It's all the same. It's all for all, whatever I said applies to all chronic diseases.
Sir, kindly see the chat box. There is one question posted to you directly.
Yeah, I see two questions there. One is about the uh, kids taking up exams in the night. How many kids are here? Because I'm going to make a statement that it's not all about
Kids are not here.
not here. Okay, so the parents must realize it's not all about education alone. We know what education offers us, and I think by age of 50 we'll all realize, yeah, I think we put up a lot of effort unnecessarily. Okay, that answers the first question. The second question, yeah, I didn't touch upon everything in the pranayama and meditation. Definitely, I think there are a few slides showing that people were going to the church, especially in Loma Linda, and others were worshipping their ancestors in Okinawa. Okay, so that is all like a meditation only. And pranayama and meditation have come up a very, very long way, unfortunately, in the West, not in India. Okay, though it all originated in India, we are again learning it, relearning it from the Westerners. So, as far as the heart disease is concerned, I consider a few of these cardiologists as my group. One of them is Dr. Dean Ornish. If there is a cardiac patient in this audience, I would request you people to buy one of his books. He has written many books. Buy one of his books and do read it. Okay, he is a disciple of Sachidananda Swamigal. Okay, a lot of us have forgotten. Sachidananda Swamigal was very close to Coimbatore, by the way, and he was his disciple. Dr. Dean Ornish was not orthodox, not an orthodox person. One day when he goes, but his mother and sister were orthodox. So when one day he just goes home, and he was as a medico, he was very upset. He was very depressed. He said, "I will commit suicide. I don't want to read this because whatever we read is not applied." And whatever I have taught you in the last 30-40 minutes is something which I gathered in the last 4-5 years on my own, not from the textbooks. So that shows whether I should have read my MBBS, MD, DM so much, so hard as what I mean, putting up burning the midnight oil. I think that answers the first question also. So Dean Ornish went home dejected one day, and he saw one person sporting a dadi and a saffron cloth, and he asked, "Who are you?" you must be a Hindu because you are wearing this sort of an attire. So Sachidananda Swamigal said, I'm not a Hindu. I'm here to undo certain things. Okay, that is when he realized that the medicine which he was learning should be in a different way. So as a first year medical student, he changed his course. He took 1 year off from his routine and he started practicing. He started learning yoga, pranayama, and meditation. He came to one of the premier institutes in Delhi. I don't need to name it. It is nothing other than AIMS. So people said, we do not know who Sachidananda Swamigal is. We do not practice yoga. Okay, he went around searching for him and he started practicing pranayama and yoga. So this is something, that is the reason why pranayama and yoga have become part of our medical education. And I'm sure you must be teaching in the schools also. So there is no second thoughts at all, I think. And mindful eating, everything mindful, I think is important. But unfortunately, our mind is full of something else all the time.
That's true.
Any more questions anyone has?
Yeah, good evening, ma'am.
Yes,
Very
sir.
I have also posted my question on the chat. I just wanted to check. First of all, thank you very much for a very informative session. I wanted to check what is good, running or walking for a better health. Doctor?
Yeah, I can see some more questions also in the chat box. Running and walking. Walking up to 150 minutes per week is what is generally recommended. That's a moderate, if you're going to go for a high speed, then something around 75 minutes per week is good enough. Now, what is more important is, in the present day, we see a lot of deaths in the people who have been running, who have been jogging, who have been playing. Okay, there are two things which are important here. One is about the diet which they do. Like we always say, people walk in the race course. So race course il nadai, pinna annapurnavil vadai. This is what really happens. Okay, the food is also important. It's more important than your weight. Second most important thing is in sometimes the people run without actually knowing what disease they harbor. So if you are going into high intensity exercises and if you have risk factors, it is better to get checked before actually indulging. Okay. Obviously, the more the exercise, better will be the outcome. So running is always better, but get yourself screened. That is the number one point. Number 2 point is, just because you are running, you cannot be very lax on your diet. Well, I think I saw one more question here on food. Yeah, fruit. Fruit juice is obviously not equivalent of fresh fruits. There is no second thought at all. Because when you take a fruit juice, you are depriving yourself of all the fiber. So what happens is all that sugar in it gets released faster, and that causes a spike. Your sugar goes up and down very fast. It goes up and then drops down. So you're tempted to take something more again and again. Okay. So that fresh juice is never advocated even for your kids. So instead give them as raw, full whole fruit. Okay. That's where I said there is minimal processing in whatever food you take. So that is the most important thing. Digital detox in the early morning and before sleep. Obviously 2 hours before sleep and 1 hour after getting up in the morning. Yeah, I'm not into naturopathy, so I think I may not be right in answering this question on cough, how to cure it naturally. But I can say one thing, adopting a whole food plant-based diet definitely helps you in a long way. I think somewhere down the line, I had written about inflammation and all. I didn't focus on those things because I was given 30 minutes. So I thought I'll have to convey few definite messages there. So definitely adopting holistic way definitely will bring down your infections. So whatever I said is all for all the chronic diseases. When I say chronic diseases, what does it mean? So it is for hypertension, sugar, obesity, heart disease, some forms of cancer, some forms of kidney disease, and certain autoimmune diseases. bronchial asthma also gets much better. So your cough may be because of that also. That also gets much better when you adopt a whole food plant-based diet. So even I had some autoimmune diseases which are very well under control, and I have not gone for any of the high-end medications which are full of toxicity.
Doctor, can BP blood pressure be reversed?
Sir, unmute yourself.
Yeah,
Hello.
please.
Yeah, we can hear you. Say, sir.
Yeah, good evening once again.
Yeah.
Can these chronic diseases like BP, blood pressure, or diabetes be reversed by a way in which you have mentioned how to make your lifestyle better?
Yeah, just a minute. Well, in the early stages, many of these diseases are very much reversible. Okay, so you must know, it doesn't mean that when it was diagnosed. Okay, for the blood pressure part, we always check certain things to see whether we should definitely put you on medications or not. Okay, like when you keep on doing exercises, weight bearing exercises, what happens to your muscle?
It tears down and again builds up.
Somebody answer. What happens to your muscles when you keep on, you start building muscles, isn't it? You become muscular. Okay, similarly, when the heart keeps pumping against a very high blood pressure, the heart muscle becomes thick. Okay, so they will search for evidence of whether that doesn't happen overnight. It has to, when the heart has been pumping against a very high blood pressure for a very long time, then the heart muscles becomes thick. So this is something which we find out by doing an ECG and echo. So if you have an evidence that the BP has been there for a very long time and it has already affected the heart, then better not to stop the medications at all. But none of these evidences are there. It is important that you start adopting lifestyle modification before you put yourself on a medication. And that is definitely reversible, provided you sustain the habits. That's the most difficult and most often not followed stuff. Okay. As far as the sugar is concerned, again, if there is no organ damage in the sense your heart has not been affected, your kidney has been not affected, your eyes have not been affected by diabetes, then it is always worth trying for some time lifestyle modification before you put yourselves on medication. This is something which is not regularly followed by both the patients and the doctors. I should admit that. Okay, but if you have started the medications and if you're starting on lifestyle modification, that's a good possibility that you may be able to reduce the medication and go off medications also. If your sugar has been there only for less than 5 years or so, 5 to 7 years or so. So it is possible to have a reversal of heart disease. Okay, the third one is about a reversal of heart disease. Reversal of diabetes is what I said. Reversal of heart disease. I was quoting about Dean Ornish. Dean Ornish has written a book called Reversal of Heart Disease. Okay, so that basically is to say that when you do an angiogram, there is a blockage, and he puts these people on this sort of a lifestyle modification, focusing mainly on the diet, stress. He calls it as love and exercise. Just four pillars he focuses, and he has done repeat angiograms in these people to show that the blockages have come down. Okay, they don't reverse completely, but they come down. So that is highly possible. A similar program has been conducted by us before the COVID. So we had 30 patients with us who had already undergone bypass surgery or multiple procedures, stenting, and they kept on coming to us with the pain. We had put them inside the hospital for 10 days and gave the food which we wanted them to eat regularly. These people were followed up for 1 year and they were doing very well. Okay, we didn't do a repeat angiogram. COVID came and we dropped. We are restarting the program next month. But these things are definitely reversible. You could come down on the medicines. But as I said, sustenance is the most important key.
Thank you so much, sir. Would anyone like to give the feedback, how you enjoyed the session, or what benefit you have derived from the session? Would anyone unmute and then share your feedback?
Actually, Didi, there was a question which I had sent. Could you please ask that? Yeah.
Okay, sir, Swamiji has a question. Can I ask?
Yeah, sure.
Yeah. Students generally are sleeping late in the night. They're awake in the night and they're getting up late in the morning. And some of the psychologists are also endorsing this as normal. So what is your view? Sleeping early and getting up early is better, or sleeping late and getting up late is better?
Obviously, I'm sorry. Yeah, obviously, sleeping earlier and getting up earlier is the best way to do it.
Hmm.
There's no second thoughts. I'm sure you must be preaching that one,
Yes.
but it's almost never followed. That is the problem.
Mm, that's true. Okay, anyone wishes to give the feedback? Unmute yourself and please share your feedback. Some one or two of you.
I have a question. Is it okay to ask or getting a little late?
Yes, Amma can ask.
Yeah. Good evening, doctor. Thank you so much. It was a very enlightening session. They refer to something called as cardio fitness. What does that refer to? Is there a parameter? Is it measurable on what is the aspect? How do we measure cardio fitness?
Well, I was talking about the program which we run. That is where we do this. That is mainly for patients who have a cardiac disease already. So we go through what is called as a 6-minute walk test, or something called as a cardiopulmonary exercise testing. So when you exercise, your muscles basically need glucose and oxygen, isn't it? Okay, this when you do a treadmill, I'm sure most of you would have done a treadmill in the hospital. So in the treadmill, what we do is basically we connect you to an ECG and see whether your ECG shows some changes, and the person who does the treadmill keeps asking you whether you have chest pain or breathlessness or something like that. Okay, so if the ECG shows changes, that basically means there is reduced blood flow in the heart. That's one way we can assess your cardiac fitness. But the much more important thing is basically to see whether you are getting enough of oxygen in that. Okay, so this cardiopulmonary exercise testing is basically like a treadmill, but what happens is you are put on a mask, so you know how much of oxygen goes inside you and how much is being consumed when you are exercising. Okay, so this is a test which we do for people who have already had a heart problem, or people. I think I answered this question indirectly without naming this. Somebody asked about running and walking. Okay, and that time I said when you go to a doctor and get yourself tested. This is a test which we prescribe for people who are into a high intensity exercise, or for vulnerable people. I do not know whether the word is right, or who can put us into trouble. Okay, like for example, a pilot. Okay, when the pilot gets into a problem, obviously the whole team gets into, I mean, the whoever who is traveling, no? So these people are to be tested this way. So this is the cardiac fitness which we do, but not all the hospitals have this machine. Okay, it's relatively cumbersome to use, both for the patient and for the interpretation, because there are hundreds and hundreds of parameters in that, and it itself has become a specialized field. So what we do is basically we do a 6-minute walk test. 6-minute walk test means we just we post pillars uh, on the floor, and we see how much of distance the person can cover in 6-minute walk, 6 minutes. Okay, so we tell that you're covering around 200 meters, 300 meters, 400 or 500 meters. So that will tell us how much of that, but with some formula we also calculate how much of oxygen is consumed. Okay, and then we advise next week, 1 month post heart attack, you are walking this much, so you can walk this much more in the next 1 month. This is something which we calculate and tell them.
Thank you.
Anyone wishes to give feedback? Please
Madam,
unmute this. Yes.
Hariom, ma'am.
Yes, say.
Sir, doctor, good evening, and thank you so much for the knowledge sharing session. I have a small question about the role of coconut oil related to the heart, because so there is a two impressions for using and which will be affecting the heart. Any small suggestion from you, sir?
Yeah, coconut oil, as you said, it is pretty controversial because allopathy, as such, I mean, there's no controversy as far as allopathy is concerned. Ayurveda advocates that, okay, but allopathy in a lot of studies have come up in the recent past saying that do not use coconut oil. Okay, I will have to substantiate in a different way. So when you take Indian states, I showed you a picture of the globe saying that India is very badly placed in terms of heart disease. What is your guess as far as the Indian states are concerned? Which state has the highest heart problem?
Kerala.
No, Kerala people don't have, I think, sir.
I'm not sure either. I heard. I'm sorry. I didn't switch on the other one.
No.
Kerala, doctor. Kerala.
Yeah, exactly. So it's Kerala. Okay. So, and we all know that the Keralites are the ones who use the maximum amount of coconut oil, isn't it? Coconut and coconut oil. Of course, apart from their very bad, I was recently preparing for a talk in Kerala. Most of this weekends either I'm inside the forest or giving a talk somewhere and utilize that to get into the nature. That's what I have started doing these days. So that time also I went through a lot of literature which definitely says coconut oil is not good. Okay, at the same time, Ayurveda says yes. Of course, naturopathy also doesn't say that you can use coconut oil. Only it's Ayurveda, and unfortunate with Ayurveda is that it's not backed up with studies.
I think we should wind up now. Thank you, sir. Thank you. Yeah. So I'm very, very grateful to Rajendran sir for coming and sharing such beautiful information with all of us. Your beautiful stories, your animated presentation, everything gave a wonderful insight into how to live our life. Thank you so much, sir. Thank you. On behalf of everyone, we extend our gratitude for sparing your time with all of us. Thank you so much.
Thank you very much, sir.
Thank you. Thank you very much.
Thank you, sir.
Thank you
very much, sir.
Thank you, ma'am.
We'll just conclude with Shanti Mantra. Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnameva Vashishyate. Om Shanti Shanti Shanti. Hari Om Shri Gurubhyo Namaha. Hari Om. You can unmute and say thank you to sir.
Thank you, sir.
Thank you so much.
So much, sir.
Thank you, sir. Hari Om.
Thank you very much for the patient
Thank you very
listening.
much, sir.
I really loved it. Thank you very much.
Thank you, sir.
Thank you, sir, and Hari Om.
Thank you, sir.
Thank you all of you for joining.
Thank you, ma'am. Hari Om, ma'am.
Thank you, ma'am. Thank you,
Hari Om,
Hari Om.
sir. Hari Om.
Hari Om, ma'am. Thank you very much.
Hari Om, sir. Thank you.
Hari Om, ma'am, and thank you so much.
Thank you. Thank you, Dr. Sir. It was great listening. Thank you.
Thank you, doctor.